So the purpose of our presentation today is the first part will be briefly talking to you about pharmacy services within New Zealand. I'll then pass on to Sheenal, who will share with you some real walk-life examples that she's come across interacting with Pacific patients. And the third and final part of the presentation is about the Pacific Pharmacists Association. So who are we and what are we trying to achieve? Okay. So, oops. There you go. So we are all very much aware of the many challenges that the current New Zealand health system faces. For too many years, our communities, our whānau, our individuals have suffered from a siloed approach to health and community care support. So we need models of care that are proactive and collaborative, and these need to be accessible and attainable at the front line so that our people can get well, stay well, and achieve their well-being goals. Pharmacists are an integral part of most people's experience of healthcare, both in the community setting and in the hospitals. However, our current models of care do not make the best use of pharmacists' capacity or unique skill sets and do not promote a one-team approach to providing healthcare. So a statement from the Pharmacy Action Plan states that although the pharmacist workforce is young and highly qualified, their skills remain underused in the wider health setting. Yes, yet there is good evidence to show that making better use of their skills improves health outcomes and makes the use of medicine safer. So New Zealand has more than 3,500 practicing pharmacists. Over 75% of these are based in the community, providing a range of services. There are close to about 1,000 community pharmacists in New Zealand, which over 1.3 million people visit on a monthly basis. So community pharmacy is often the part of the health system that people have the most access to or the easiest access to. A prescribed medicine is the most frequent clinical intervention provided to patients. In 2014-2015 financial year, 43 million prescription items were filled in New Zealand, which meant that about 3.5 million people got funded medicines in New Zealand. So, ensuring that medicines are dispensed and used safely, that patients receive maximum benefit from the correct medicines, and that there is minimum wastage is the core role of pharmacists. Pharmacists are also trained to provide and pharmacists are also trained to diagnose and provide treatments for minor ailments within the community, such as urinary tract infections, eye infections, emergency contraception, wound care, cough and colds, or refer you to the GP if necessary. So in addition to our core roles, pharmacists also provide a range of specialized services with the aim of working in partnership with other health professionals and our communities to improve access and to improve medicines-related health outcomes for our communities. Examples of these services include smoking cessation, oral contraceptive, point-of-care testing for gout, for warfarin, for diabetes, needle exchange, screening, and vaccinations. So pharmacists also provide a range of medicines management services such as medicines use reviews. So these services are aimed to optimize patients' adherence to medications, reduce medication confusion, remove waste, improve self-management, and improve people's understandings about their medicines and the conditions they are related to. Majority of these services are funded by their local DHB, so patients don't have to pay anything extra for these services. But the challenge that we in community pharmacies face is that most patients, including other health professionals, aren't aware of these services, so they aren't able to engage with the services or make the best use of these services. I will now pass on to Sheenal, who will share with you some examples of interactions that she's come across in her community pharmacy setting.
Hello everybody, I'm Sheenal and I'm a community pharmacist. All my work hours are spent in the community with patients. Every single day I'm seeing patients, I'm greeting them, I'm taking prescriptions off their hands, I'm dispensing their medicines, I'm counseling, etc. When I'm not doing this, I could be sore throat swabbing, doing vaccinations, doing warfarin INR checks, etc. Medicines use reviews, MURs, etc. Pacific Health in Aotearoa means the following to me. When I look at the list of patients who've made their 3-month worth of medication last 5 months, it is predominantly Pacific people. At the end of the day, when I look at the names of people who have not turned up for their warfarin INR tests, it is predominantly Maori Pacific people. When I look at the list of patients who need extra funding to help with their medicine costs and Bistapac charges, it is predominantly them. I have come today to share and to learn what we all could do better, to share what I think could work and to learn what you all are doing for your patients. So what could we do better? At my pharmacy, we do quite a bit of MURs, which are medicine use reviews. This is a review of medicines with the patient, mainly how they take their medicines or not, and the knowledge or lack of behind their health conditions. The two things that we focus on at my pharmacy are adherence and knowledge. This is not a clinic. This is not an education session. We do not tell them what to do. We find out what they know, and we try and fill in the gaps and connect the dots. Typically, I would begin by asking them a simple question, and this is something along the lines of, why is treating diabetes important to you? In response, I would get some like, to help with the pain in my body, or to prevent me going into hospital. I find that patients are very good at telling me what they know. So these are things like what numbers their glucose test should be in the morning, or what foods to avoid. I feel that most patients are not able to tell me anything more than diabetes is too much sugar in the blood. They go to their eye tests and they know it's important. They don't know why it's important. I feel that as health professionals, we give people a lot of advice and tips on portion control, exercise, testing, etc. Yet we are not delivering the why. At work, when we sit down with patients, we try and address this. We talk about why reducing cholesterol is important and why diabetes affects eye health and foot health, etc. Having been born and brought up in Fiji, I would like to think that I adapt to the Pacific way of delivering healthcare well. But I'm standing here today because I sometimes struggle. At uni, we were particularly not taught about this adapting our way based on different cultures, and it was only in the last few years that I began to realize that it's upon us as frontline healthcare professionals to be able to drive this change. I would like to share a few real work stories, and this has all happened in the last month, that have influenced my thoughts. Last month, I checked a prescription for a Pacific man in his 50s. He was new to us, and there were a few people waiting in the shop. I called out his name. I counseled about his medicines. The whole time he was smiling. Afterwards, as we finished, he said to me, "Can I say something to you?" Of course I said. He said, "You said my name beautifully, exactly how it's supposed to be said, like a professional." He shook my hand and left. I walked back into the dispensary and I thought, my counseling didn't matter. How I said his name was of more importance to him. At that moment, I became the professional. Last month, I had a New Zealand patient whose diabetes numbers had doubled due to not taking his tablets. I asked him a very simple question: why is treating diabetes important to you? He said to me, because I'm hoping it'll get rid of the pain in my shoulder. He's had diabetes for many years. When we see patients like this at work, we sometimes wonder, how is it that we've come to this stage where he's had diabetes for many years, been to many education sessions, and yet there's this gap in knowledge. He's obviously not understood. He has gone to all his appointments and just probably still doesn't understand very much. How can we help these people better is a big question in community pharmacy at this stage. He knew metformin was for diabetes. He knew diabetes was too much sugar in the blood. He didn't know why treating it was important. My own take-home message: talking about diabetes medicines and adherence and blister packing and delivering them to the door does nothing if a patient doesn't understand the why. Another example, we had an intern pharmacist from a hospital observing community pharmacy for a week. He sat down with me on a medicines use review consultation. This patient was a typical cardiovascular heart patient. He was on diabetes medicines as well and on citalopram, which is an antidepressant. Afterwards, I asked the intern for his thoughts. The intern said to me, "I think his antidepressant medications need to be optimized. The patient was looking down the whole time. He's obviously very sad. He didn't make eye contact once." We sat down and I was telling him he was doing it out of respect. Looking directly in one's eye and talking can be seen as very interrogating in some cultures. I don't think the problem was that at that time. We had a new patient from North Shore, and this was 2 weeks ago, a 60-year-old Samoan man who is currently on a wait list waiting for a kidney transplant. He takes 15 tablets a day. We blister packed his tablets. We sat down with him. We told him what his medicines are doing for him. 3 months later, his HbA1c dropped by 9 units. That's almost a 10-unit drop by just sitting down with him and talking to him about his medicines. I could go on, but I just wanted to highlight a few things here. I believe we can do all we want from a policy level, but we won't achieve much if it is not patient-centered. The above were some stories, but we are interested in the delivery. In summary, cultural competence. Let's build on this. Patient relationship is key. Pronouncing their name right starts it off on a good note. Connections. We can discuss ideas, and every service starts with an idea. But let's deliver. Let's empower our profession to be able to deliver services well, and let's empower our people to take charge of their health. 2 years ago, our pharmacy trialed a finger prick HbA1c testing as part of our pilot. We had a machine set up in the pharmacy. We could perform these tests on the spot. We are easily accessible, no appointments required, and the patients and their families were able to get a result for themselves right there and then. After a doctor's appointment, patients usually come to our pharmacy anyway. While they're waiting for their medicines, we tested them. I was starting to see patients become really interested in their result, become really interested in what the number came up with, because it was happening right there and then. They were engaged. We retested them after 3 months, after putting a few action points in place. We talked to them every month when they came in to collect their medicines. The result for the patient, the numbers decreased. Picking up their medicines on time, taking them every day, being accountable, helped them. The result for the pharmacy, there was no funding to support this. We don't do this anymore. I feel there is scope for service expansion. We test for INR, which is warfarin, at the pharmacy, and we titrate doses and all accordingly. I don't see why something like this could not be developed for diabetes. Our patients present to us in their own time with no appointment restriction. Pharmacists are well trained and accessible. I don't see why a capable workforce could not be utilized to deliver or expand on such services. We need to build understanding. What we can offer as community pharmacists: reminder services, health coaching, for example, nutrition, exercise, management of pens and meters, adherence support, HbA1c testing. More importantly, we need these services funded for our patients so we can deliver them. As I said earlier, I'm here to share my experiences and also learn from you all. Thank you, PHARMAC, for the opportunity. I'll now get Diana. She will talk a little bit about Pacific Pharmacists Association and our role.
So I recently did a literature review as part of my master's studies and to build on my knowledge of Pacific people's knowledge, experience, and use of pharmacy services within New Zealand. The first thing I found out with my literature review was that there was insufficient published research in this area, so particularly looking at Pacific people and pharmacy services within New Zealand, which means that there is a poor evidence base to inform our strategies and policies and plans. So this is where a network like the Pacific Pharmacists Association could be quite useful. So other key findings from the literature review that I'd like to share with you today include: the New Zealand health system is complex and Pacific communities find it difficult to navigate it, creating avoidable and unnecessary barriers and equity issues. Pacific people are more likely to treat pharmacies as a prescription depot, and as I highlighted earlier, they aren't aware of the various specialized services that pharmacists provide and therefore aren't able to engage with them or make the best use of those services. So factors that either facilitate or impede Pacific people engaging with pharmacy services in New Zealand. So there's always the commonly reported issues of cost, time, and transportation. Pacific patients also place a lot of value on the quality of interaction between the health professional and the patient, which includes language, not just verbal language, but body language as well. Taking time out to build rapport and trust with the patient, showing empathy and shared decision making. Respect is also a very important concept in Pacific culture, and as Sheenal highlighted, an example of bowing their heads down, having their arms folded, not questioning could be a sign of respect, but in normal everyday New Zealand context, it can be mistaken as a sign of the patient not being engaged when that's not actually the case. Many Pacific people have also reported having anxiety and lack of confidence in communicating with their health professionals, especially among the older Pacific generation due to language barriers, and there's a lack of translators within the community as well. Some Pacific people also want to use traditional healing methods alongside orthodox medicine, but do not feel respected by their health professionals for their beliefs. So when Pacific people experience rejection, they lose confidence in the service and are less likely to engage with those services. So although up to 90% of Pacific people in New Zealand speak English, for many it is a second language. So on the surface, language may not seem like a barrier, but their comprehension may be limited. So this makes it harder for them to understand important health messages, including prescription labels. I had an example of a prescription label that said 1 tablet daily with food, but the patient ended up taking a medicine every time they ate during the day. So, funny, but Pacific people also find it difficult to identify their medicines by its name or state what condition that particular medicine is for. So they may recognize a medicine by their packaging or by the first letter of their generic name, of their brand name, but they find this whole generic brand name quite confusing. Inability to read English label means they rely quite heavily on their pharmacist to tell them how and when to take their medicines properly. So in some instances, Pacific people stop taking their medications because they feel better and they don't understand the reasons as to why they need to take their medications long term. Gout is a very good example of when the gout pain is gone, the medicines are gone, because why do I need those medicines? So most of us are already aware of these factors, but I'm choosing to highlight them here today because I feel these are important points that we need to be aware of and to keep in mind when we design services and strategies that are aimed at Pacific people. So without this knowledge and understanding, pharmacy and health services in New Zealand will continue to be delivered in a one-size-fits-all approach and will lead to growing inequity issues and growing disparities between Pacific people and the mainstream population. So the Pacific Pharmacists Association was formed in part to address these factors that we encounter in practice every day. So who are we? The Pacific Pharmacists Association, or PPA as we call, is an association for Pacific pharmacy professionals in New Zealand. Our key stakeholders are Pacific pharmacists, technicians, interns, pharmacy assistants, pharmacy students, and the Pacific community. So how and why did this association come about? The underlying factor that brought Casey, Natalia, and myself, the founding members, together to form PPA is our passion and commitment to make a meaningful difference to our Pacific communities and our profession. We aim to make pharmacy services more accessible and responsive to Pacific people in New Zealand. Casey and I went to Aotearoa Pharmacy School together. At the university, as Pacifica students, we had a solid network of support. We had the Pacific Island Centre, we had the Fijian and Samoan Students Association, we had the Pacific Island Health Professionals Association. So we were surrounded by people who could meet our academic needs as well as our cultural needs. So once we left university in 2009, that support was completely gone. And all of a sudden, we were all each to our own. So Casey started a Facebook page for PPA in 2012 in a bid to try and connect with all other Pacific pharmacy health professionals in New Zealand. Then in 2017 came on board PHARMAC as part of their Pacific responsive strategy and assisted us by providing some seed funding to get us off the ground. Casey, Natalia, and I then walked numerous hours to get ourselves established as an incorporated society, engaged with a consulting company and designed our strategic framework and held our very successful networking event in March in Auckland this year. So our purpose is to work together to empower Pacific communities to achieve equity and best medicines-related health outcomes for our people. So these are our values that guide our strategic areas and objectives and are what we recognize while walking towards our vision. So togetherness, we acknowledge the Pacific cultures, values, and customs that are unique to each island in our sea of islands. We will walk together with our people, our pharmacy colleagues, and the wider health sector. Commitment, we are committed and accountable to our members, our communities, and our profession. Quality improvement and innovation. So we want to build a strong foundation for a well-equipped workforce. We want to reduce variability in care and enhance the innovative pharmacy services so they are more responsive to Pacific communities. Leadership, we want to foster and nurture Pacific leaders in healthcare. We want the Pacific pharmacy workforce to be recognized and valued for their key role in healthcare. So these are 4 strategic areas that have been identified as key focus points needed to achieving our vision. So our objectives stem from these strategic areas. Educating to empower, so our objectives include promoting pharmacy as a profession, improving cultural competency of the profession, and health literacy of our communities and the profession. Advocating to drive change, our objectives include advocating on behalf of our members, enhancing the profile of Pacific pharmacists, and representing our members on issues and initiatives that concern our profession, our communities, and the delivery of health services to Pacific people. So networking for greater impact includes building stronger networks between members of the Pacific pharmacy workforce and fostering relationships with other organizations and groups that have similar goals as ours. Strengthening an innovative workforce. A strong workforce is one that reflects the population it serves. Currently out of the pharmacy workforce, only 1% of people identify as Pacifica. So initiatives will include supporting professional development of PPA members, providing supports to students interested in pursuing careers in pharmacy, disseminating key information on trainings, scholarship and funding to our members, and providing mentoring and support to students that are currently enrolled in pharmacy courses, sorry. So our initial efforts pretty much have been focused on increasing the visibility of PPA. So we do quite a bit of presentations at opportunities like this. Also connecting with potential Pacific members, health professional organizations and stuff, and promoting pharmacy as a career amongst our Pacific communities, including schools. Also building relationships with other Pacifica health professional organizations. So if you're here and interested to collaborate with us, then please yes, either meet myself or Sheenal. So what will success look like for us in the first 24 months? So membership of the Pacific Pharmacists Association is going to continue to grow. Our Pacific communities will have better or easier access to easy to understand information about their medicines or about their health conditions. So Pacifica people will be empowered to have conversations with their pharmacy service providers. We'll have formed and strengthened relationships across the health sector, and Pacific youth are also more aware of pharmacy as a career option in healthcare and choose to enroll in pharmacy-related courses.